Hi, my name's Hollie and I'm doing my health assessment validation video for nursing term 2. First, I'm going to start by washing my hands. Making sure my hands are pointing in a downward motion so the water runs down to my fingertips. Now that I've washed my hands, I'm going to go meet my patient and introduce myself. Andrew?
Hey.
Hi, Andrew. My name's Hollie. I'm going to be your nurse today. Can I have your full name and date of birth?
My name's Andrew Barrows. I was born 12/12/89.
All right, thank you. Want to stand up with me? And then we'll take a walk over to the scale. We're going to take your height and weight, your waist circumference. We'll calculate your BMI. So take your shoes off. And you let me know. Yeah. It's like you've done this before. Yeah. 200 pounds. Perfect. Comfortable? Yeah. And weight to the side. Great. You are 6'1". So, alright, now I'm going to take your, you can put your shoes on.
Oh.
Your waist circumference. Waist circumference of 36. Anything under 40 is normal for a male.
Great.
And your BMI. Perfect. Your BMI is 26, Andrew. Alright. Now as we're walking to your exam room, we're going to do a little test here. Can you walk heel to toe? Perfect. Now how about just on your toes? How about on your heels? Alright, perfect. We can walk over here. Yeah. Alright. Just gonna close the curtain for some privacy. Alright, Andrew, can you turn that way? Alright, can you bend over? I'm just gonna check for spine alignment. Perfect, no abnormalities, spine's aligned, hips are, you can stand up now.
Okay.
Hips are symmetrical, intact. Alright, can you close your eyes? I'm gonna do a Romberg test on you. It's just gonna check your balance. I'm gonna be standing right here in case you need some assistance, alright?
Okay.
Alright, can you just close your eyes?
Okay.
Alright, perfect. I'm gonna check this for 20 seconds. Alright, good, Andrew. Got good balance here. Alright, you can take a seat.
Okay.
Alright, so what brought you in today?
She did a physical.
For what?
Nursing school.
Nursing school. Have you already started?
Yeah.
You did? What term are you in our semester?
2.
2. So what are you doing in school?
Learning lots of stuff.
Like what?
Health assessments.
Health assessments? That's good. Well, today will be good practice for you. I'm going to do a full head-to-toe assessment for your nursing school so you can go off to clinical.
Yeah,
All
hopefully you
right?
can teach me.
Oh, I hope so. That'll be good. So, all right. So what time is your appointment for?
1 o'clock.
What day is it?
Friday.
Perfect. All right, Andrew, can you grab my hands? And can you resist? And down. Perfect. Same thing with up here. Up. Like you push on the gas pedal. All right. Perfect. So I'm just gonna check some cranial nerves, okay?
Okay.
But first I'm gonna see if your pupils are equal and reactive to light, alright? You're gonna take a look at my nose. Alright, so you're gonna take a look at the top of my pen light, alright?
No, I didn't. Yeah.
Alright, so my patient's speech is clear. He's not slurring his words. He's alert to person, place, time, situation. So he's alert and oriented times 4. Now I'm gonna do you 6 cardinal gazes, okay? You're gonna take a look at the top of my pen light. You're gonna use your eyes, not your head, alright? Alright, your extraocular movements are good. Can you smile for me? How about frown? Can you stick out your tongue? Move it side to side? How about puff out your cheeks? And wrinkle your forehead? Can you push up on my hands? Perfect. Cranial nerves 2 through 12 are intact. You want to stand up for me real quick? We're going to do a little exercising. Can you put your hands out in a T? Can you move them in a circular motion? Perfect. How about if you move your hands in front of you? Pretend like you're picking up some weights. Alright, good. Now, your hip. We're going to take your right hip. We're going to take it away from the body. That's called abduction. Now we're going to move it back to midline. Same thing with this leg. You've done this before, haven't you?
Yep.
Alright, now we're going to bring up your leg. Perfect. This leg. Perfect. How about we circle these ankles? Good. Can you take your toes and invert them? And how about evert them? Good. Inversion and eversion. Alright, perfect. You may take a seat. Alright, Andrew, I'll be right back. I actually have to get a tongue depressor, okay? Alright, well, since I left my patient's room, I would wash my hands. And, alright, well, this would be a good time to take my patient's vital signs, so here's the card. Try to see. Alright, Andrew, do you have a arm that you prefer?
Whatever.
Whatever. Alright, let's turn this thing on. Alright, I'll use this one. How you feeling today?
Good.
Do you have any allergies?
No.
Are you taking any medications?
No.
Alright. I have this finger. Perfect. Alright, Andrew. Can you open up? Thank you. Alright, you have a temp of 97.4. That's within normal range. Your blood pressure is 144/91. Do you have any history of cardiac disease, hypertension?
No, I just drank a ton of
No.
coffee this morning.
Oh,
and
well,
running around.
sometimes when you drink caffeine, your vital signs will raise.
Mhm.
Do you have a blood pressure cuff at home, anything of this type?
Yeah.
Since you did have one high pressure, I'm not going to be too worried about it today, but I would definitely keep an eye on that at home. Okay? Alright, Andrew, so I got the tongue depressor. I'm just gonna get it ready. I'm gonna inspect your head and neck. I'm gonna use this tongue depressor to look inside your mouth, which is also called your oral cavity. All right, I'm inspecting my patient's head and neck. It seems to be free of lesions, no drainage. Skin is intact. I'm gonna palpate my patient's head. Hair is evenly distributed. No signs of masses, any lesions, no wounds. Perfect. My patient's hair is black. Now I'm gonna take a look at your eyes. Ears are symmetrical with the eyebrow. I'm just gonna pull down in your conjunctiva over here. All right, perfect. Conjunctiva is pink, sclera is white, no signs of obvious drainage. I'm gonna palpate my patient's pinna, looking for any lumps, masses, lesions. If I had an otoscope, I would pull up and back looking at my patient's tympanic membrane. Tympanic membrane is intact and pearly gray. I'm gonna do the same thing over here, palpating the pinna. No lumps, masses. Gonna do the same thing, pull up and back. Tympanic membrane is intact, pearly gray. No signs of any drainage, no extra crewmen in there. Perfect, you're doing good. When you clean your ears, do you stick anything in them?
Yeah, I use a Q-tip.
You shouldn't do that.
I
You can
know.
damage the tympanic membrane.
I don't know. I just feel dirty if I don't do it.
Well, I understand. All right, I'm just gonna take a look at your neck here. No obvious scarring, no signs of open wounds. I'm gonna palpate your pre-auricular, post-auricular, submaxillary, and supraclavicular lymph nodes. No lymph nodes are palpable. That's a good sign. I'm just gonna inspect for the trachea. Trachea is midline. Can you swallow for me? All right, good. Thyroid gland not palpable. Great. I'm gonna take a look in my patient's nose and oral cavity. Free of lesions, no signs of drainage. Perfect. Now I'm gonna have you cover one nostril and blow onto my finger. Good. Now the other side. No signs of deviated septum. How are you sleeping at night?
Okay.
Okay, good. All right. Can you open up your mouth for me? I'm just gonna inspect the oral cavity. It's pink, moist, free of lesions. I'm gonna take my tongue depressor. Can you stick out your tongue? How about say ah? All right, good. The uvula and soft palate go up and back. Soft palate and hard palate are intact. All right, so now I'm just gonna inspect your chest, all right, anteriorly and posteriorly. My patient's nares are not flailing. There's no obvious signs of barrel chest. He does not seem to be in any form of respiratory distress. Accessory muscles are not being used. He has an easy, non-labored breathing. Good, Andrew. All right, so now I'm just going to, do you have a tank top on underneath there?
I do.
All right, can you take that shirt off for me?
Oh, sure.
Thank you.
Sorry. Did I get all up on you?
No, it's fine. All right, so I'm inspecting my patient's chest. There's no signs of any wounds. I'm gonna palpate. I'm not palpating any masses, which that is a good sign. All right, I'm gonna palpate the posterior side of your chest. How you doing?
Fantastic.
In any pain?
Not at all.
None. All right, if at any point during this exam you do experience pain, please let me know.
Okay.
All right. All right, while I'm back here, can you say 99?
99.
And again?
99.
And again.
99.
Perfect. My patient's tactile femoris is strong, starting up at the top and weakening as we get down to the base. All right, now we're gonna do some percussion. Do you know what percussion is?
Mm-hmm.
All right. When I percuss a healthy lung, I want to hear resonance, okay?
Mm-hmm.
Good. Good. And this resonance is exactly what I heard. Now I'm going to do the same thing on the back side. Good, Andrew. Resonance again. So I'm going to have you take a nice deep breath for me.
Okay.
All right. And good. My patient's thoracic expansion. My thumbs moved 1.5 to 2 centimeters, which is a perfect finding in a patient this age. All right, Andrew. Now I'm going to take my stethoscope and I'm going to auscultate your lungs. I'm going to do 6 on the front, 10 on the back. While I'm over here, I'm going to check skin turgor. Non-tenting, that's perfect. I'm going to check capillary refill. My patient has no visible signs of dehydration. Cap refill was less than 3 seconds. Now when I have my stethoscope, I'm going to have you take nice deep breaths with your mouth open, okay?
Okay.
This is just to listen to your lung sounds. All right, nice deep breath. And again. And again. How are you doing?
Doing good?
You're doing okay?
Yeah.
All right. Any difficulty breathing?
No.
No? All right. I'm going to do the same thing. I'm going to do 10 on this side. If you need a break, let me know.
Okay.
Okay? Nice deep breath, Andrew. And again. And again. All right. Perfect. My patient's lung sounds are clear bilateral. No signs of wheezing, any bronchi, any adventitious sounds. That's great. How are you feeling?
Good.
Good. All right. Now we're going to move on to your cardiac assessment. So I'm going to have you lay down in this bed
Sure.
at a nice 45-degree angle. If you don't mind, I'm just going to move your shirt out of the way. If you could uncross your legs, that would be great. Thank you. Just going to pull your side rail down because I'm short and I don't want to be leaning over it.
Okay.
All right, so I'm just gonna inspect my patient's precordium. It doesn't seem like he has any abnormal pulsations going on. He's free of wounds, no lesions. Perfect. Now I'm gonna palpate. And I'm palpating for the second intercostal space, right sternal border. That will be my aortic. Second intercostal space, left sternal border, that's my pulmonic. Go down to third intercostal space, left sternal border, that's my Erb's point. I'm gonna go down to my fourth intercostal space, left sternal border, that is my tricuspid. Now I'm gonna go over to my fifth intercostal space, mid-clavicular line, and that's my mitral valve. That is also where I would listen to my patient's apical pulse for 1 full minute. Now I'm gonna go ahead with my stethoscope, Andrew. I'm gonna take a listen to your heart, okay?
Okay.
I'm gonna inspect all those spots, make sure that there are no extra heart sounds.
Cool.
Okay? How you doing?
Awesome.
All right. All right. Mucosa is pink and moist. There's no signs of periodontal disease. Do you ever want to injure? No. I mean, the tongue depressor. You stick your tongue out. You feeling moves up and back. Excellent. What I want to do. No signs of periodontal disease. No checks cavities. Now I'm going to take a listen to your apical pulse for 1 full minute, okay?
Okay.
No signs of drainage or serum buildup. Dryness perfect. I got an apical pulse of 76. Now I'm just gonna take the opposite end of my stethoscope. This is called the bell. I'm gonna switch it over and I'm gonna listen to all of your landmarks that I pointed out earlier, just to make sure that there's really no murmurs, extra heart sounds. Your pulse was, it was nice and strong. All right.
Cool.
Alright, while I'm over here, Andrew, can you just turn your head that way? Alright, my patient has no signs of JVD. I'm gonna listen for bruit. Can you turn your head a little bit? There we go, thank you.
Breath sounds are clear and equal bilaterally.
This
Move on to the anterior or the posterior thorax.
No bruits are noted. How you doing, Andrew?
Awesome.
Alright, are you okay if I put your head down?
Yeah.
Alright. Now I'm gonna move on to your abdominal assessment, okay?
All right.
Alright, Andrew, can you lift up your shirt? Is that okay with you? Alright, I'm observing my patient's abdomen. There is no distension, no visible pulsations, no open wounds, no lesions. Alright, perfect. I'm gonna listen to your bowel sounds.
Okay.
Alright?
Yeah.
I'm starting in the right lower quadrant, working my way clockwise. I'm looking for 5 to 35 clicks in each quadrant. You had some active bowel sounds, my friend.
Oh, that's good.
That's good.
Yeah.
All right, now I'm gonna percuss. When I'm percussing your abdomen, I should hear tympany.
Okay.
Okay?
Have you set halfway back here, 45-degree angle. We're gonna do your cardiac.
Good, and that's exactly what I heard. Are you okay with me palpating?
Go for
Do
it.
you have any pain?
Not at all.
No. You still doing okay? Alright, now I'm going to do a little bit deeper of palpation. I just need you to let me know if anything hurts, alright?
Okay.
Alright, good. No masses palpated. My patient's abdomen is not distended. I'm going to have you pull back your shirt. I'm going to put your head back in a 45-degree angle so I can check your pulses, okay?
Okay.
Alright. I'm going to check your temporal pulse. Strong, equal, bilateral. Perfect. I'm going to check your carotids by one at a time. Don't want to include blood to your brain. Alright, strong, equal, bilateral. Perfect. Now onto your brachial pulse. And your radial. I'm just going to check your popliteal real quick. Sometimes we don't always feel the popliteal ones. But you have a nice strong one.
Good.
That's good. Alright, do you mind removing your socks real quick? Alright, I'm going to check my patient's anterior, posterior tibialis. Perfect. Strong equal bilateral. Dorsalis medius. My patient's dorsalis medius pulse is strong, so I don't need the Doppler. While I'm down here, I'm going to check cap refill. Less than 3 seconds. Perfect. I'm going to check for plantar and Babinski. Can you close your eyes for me? Perfect. Negative. And negative. All right, Andrew, you can put your socks back on if you would like.
Sorry if my feet were smelling.
It's okay. So I'm going to put your bed back down. You're in overall good health. I hope your nursing school accepts this physical assessment.
I'm sure they will.
You today. You're healthy and you're ready for clinical.
Awesome.
All right.
Thanks.